I'd like to first welcome everybody here today. I'm going to go ahead and reshare my screen here. And again, welcome to the Advanced Healthcare Directives presentation with Kenrick Torkelson, attorney at law, and from Bowman and Associates. And I would like to go ahead and hand the floor over to him for his presentation. Thank you so much.
Hello, everyone. I'm Ken Torkelson. I'm broadcasting from Roseville, California. So anyway, been local a long time. Today, I'll be talking about healthcare directives and end-of-life healthcare decisions. There are different types of advanced directives, and there are advantages and disadvantages of having advanced directives. Also, I'm going to provide resources that can help you complete advanced directives. The point of an advanced healthcare directive is to plan ahead and let others know your plans. So how do you plan ahead when you don't know what the future will bring? That's a really good question. At a minimum, you just need to state in general terms what you want and leave the details up to the person that you chose to make the decisions for you. I have found just by showing the healthcare directive form to people that it makes them think about it. Nobody really wants to contemplate their mortality. Nobody wants to contemplate having a disability that would make them unable to speak about what they want. So when I first run into folks, I give them the form, and the discussion commences from there. Many of you may already have a healthcare directive, and by signing it, you had to think about it at least once. You really don't want to think about it more than that. You want to think about it, pick your people, and put it away, and then go enjoy life and hope you never have to use the darn thing. If you don't have a healthcare directive, you do need to hear the worst story that I have as to what could happen without one. Many of us will remember the Terry Chavo right to die case. I needed to tell our moderator I'm on page 4 now. I'm sorry. I'm turning pages, and so anyway, many of us will remember the Chavo right to die case. At age 26, she collapsed into a coma, no healthcare directive stating what her preferences would have been. Her family members did not agree on what her wishes would have been, her treatment, or whether she would have consented to a compassionate end to her life. Numerous court proceedings and appeals were conducted over 7 years, during which time Ms. Chavo had no quality of life. You can check out Wikipedia if you want to see more about that case, but it really demonstrates what crisis can come into a family if there is no healthcare directive. Most of us, if we were in the same situation as Ms. Chavo, would not want to be kept alive on a ventilator and feeding tubes. So to avoid a crisis, each of us should discuss with family members about what we would want if we were ever in a similar situation. We should complete an advanced directive. We should discuss the advanced directive with our primary doctor and should have the advanced directive scanned into our medical records. By doing so, we can trust that our care and end-of-life decisions will be honored. Next slide. So why do you need an advanced directive? First, it's to give your loved ones the peace of mind. Write down your wishes. Let the person you chose know what you want. Don't wait. You may lose the ability to participate in decisions about your own treatment. This can happen to anyone at any age. If you have a sudden accident or illness, your wishes will be known. As long as you're able to express your decisions, your advance directive will not be used. The healthcare providers will talk to you directly and you can keep control of your care. Next slide. So what are advance directives? Basically, it's a roadmap for your future healthcare in the event you cannot speak for yourself. It shows your preferences and choices regarding end-of-life healthcare decisions. And it's also a tool that forces you to think about who you want to make decisions and whether your wishes will be honored. Next slide. So when are advance directives used? They're only used if you are seriously ill or injured and unable to speak for yourself. It has two parts. It has the living will portion, and it has the medical power of attorney portion. Next slide. So what's a medical power of attorney? That's a written legal form that states who you want to make decisions about medical care. That person is authorized to speak for you only if you are unable to make your own medical decisions. The medical power of attorney can be used at any time, not just end of life. Your chosen person is able to choose care that is in keeping with your values, wishes, and choices. The medical power of attorney gives a much broader scope of decisions than the living will. Both are necessary to complete your advance directive and to protect your wishes for care at the end of life. So what's a living will? That's a legal document with your wishes about medical treatment. A living will states what care you want or do not want. Your right to accept or refuse treatment is protected by law. As stated before, because the future is not known and circumstances are varied and changing, you may choose not to be specific, instead leaving that up to your chosen person. So what are the advantages of health directives? One, you stay in charge of making your own decisions, even after you become unable to speak. The documents can be changed at any time, so long as you have legal capacity to make those changes. You do not need an attorney to complete it. And or the documents can help you take initiative with family and doctors to express your wishes. I've noted where you can get a free statutory advanced healthcare directive. It's at saclaw.org. That's the Sacramento County Law Library website. Most HMOs and PPOs also include those on the member website. They may not use the statutory form, but it's best to use the form that your doctor is familiar with. So either is good. Okay, are there disadvantages to the healthcare directive? There are two that I'm aware of. One is the healthcare directive may not be available. It should be scanned into your medical health chart. So you need to keep your healthcare directive in a safe, secure, and fireproof place. Make sure your agent knows where it is and how to get access to it. The second disadvantage is it may not be specific enough to be over and can be overridden by a treating doctor. It does not immediately translate into a doctor's order. So know if your doctor has personal objections to the California End-of-Life Option Act, and you may want to change your doctor if that's not compatible with your wishes. That act is fairly recent, and not all healthcare professionals are on board with it. So which forms should be used? I do have templates for beautifully thought out healthcare directions, directives with lots of options. But over the years, I've learned not to use those forms unless the client insists. I found that the doctors do not read the forms that are scanned into the patient's charts, and they only want to know if the patient has a healthcare directive and who the agent is. If the agent is not on the statutory or member form, delays in care can occur while the form is reviewed by a legal department. It's best to use the form that your doctor is familiar with and add to that form any special requests or limitations. I prepare the California statutory form for most clients. You do not want to be laying on a gurney while a lawyer reviews your healthcare directive. So how is a person determined to have competence sufficient to sign an advanced healthcare directive? A person is mentally competent as long as they can understand the rights, responsibilities, risks, or benefits involved in those decisions and the potential consequences of what they decide. So in the PowerPoint, I've quoted the law that shows when a person has the capacity to enter into a contract, which is the standard for a healthcare directive. Having a physical or mental disorder does not automatically mean a person is incapacitated. There has to be a specific inability to understand and make decisions. Okay, on the next slide, I've listed some of the standards to determine legal capacity. Level of arousal or consciousness, orientation to time, place, person, and situation, the ability to attend and concentrate, short and long-term memory, including immediate recall, the ability to understand or communicate with others, verbally or otherwise, recognition of familiar objects and familiar persons, the ability to understand and appreciate quantities, the ability to reason using abstract concepts, the ability to plan, organize, and carry out actions in one's own rational self-interest, and the ability to reason logically. So how is legal capacity determined? If an attorney is preparing it, he gets to make that determination based on his conversation with the person. Some conversations, it's readily apparent. You're talking to a person that is still all together. But if there's any question as to whether that person still has legal capacity to sign a document, a capacity evaluation should be conducted by the person's doctor. The doctor can prepare a letter outlining how the tests were conducted to arrive at the conclusion, or use the same court form that's used in conservatorship proceedings. And that's a GC 335 that can be Googled and it'll pop right up. Some doctors like the checkbox form. It has the scales for the memory tests and whatnot. The problem is it looks like it's going to be filed with a court, and that's not the test. Basically, you're just deciding whether this person can still sign a healthcare directive. Personally, I'll refuse to prepare a document if there's any question about legal capacity without a doctor weighing in on that issue. The reason is a document signed by a person without legal capacity is void. So if a person tries to use a document and that person didn't have capacity, they're really sticking their neck out doing so. So the message is, don't wait. Conservatorship proceedings are time-consuming and expensive. If a person loses legal capacity prior to signing a healthcare directive, that person can no longer sign, and a conservatorship may become necessary. The healthcare directive is usually signed at the same time that a financial, durable power of attorney is signed. The two together avoid the need for ever needing a conservatorship and can allow the private care of loved ones without incurring a great deal of time and expense. So, who should I choose? Let's see. I'm on page 17 for the PowerPoint here. So who should I choose to be my agent under a healthcare directive? This isn't an easy question, as making healthcare decisions for a loved one is not something anyone would normally want to do. In general, you need to take into consideration that the proposed person likes you and wants you to have your best life under the circumstances and wants you around. You would want the agent to be local, someone who can meet with your healthcare providers and can frequently check in on you. Hopefully is related to you and will take on the job as a labor of love and not as a paid job. And lastly, that they're a solid citizen, no motive to steal, borrow, or take advantage of you, or is under the influence of someone that does. Choose your agent and then choose at least one backup in the event your agent cannot or will not act for you. I mean, it's easy to pick your spouse, but if it's a common calamity that she can't do it or he can't do it, there needs to be a backup. You can choose as many alternates as you want. You can also ask that they act as co-agents, assuming they get along. Something not on the PowerPoint, you may want others to be in on the conversation with the doctor as to proposed care. So you can sign a standalone HIPAA waiver to allow the doctor to speak in their presence. The HIPAA waiver doesn't give the person any powers to make decisions, but it does allow them to attend the conversation. The doctor doesn't have to ask them to leave the hospital room when they discuss health care. Sometimes some families, it's a family decision, even though one person has the power. Okay, on the next slide. Okay, this deals with the statutory form, the one I use. There's really only 3 boxes to check here. One is for the form to be effective immediately. If it's not effective immediately, it's only going to come into play when the circumstances arise. The reason I recommend we check that it's effective immediately is so you can take it to your healthcare provider and have it scanned into your chart. That way there's no waiting while the doctor is figuring out who can make decisions for you. The second box is whether to prolong or not prolong life. Most of my people choose the first box to avoid unnecessary treatment when there's no hope. Others will choose the prolonged life because of their own personal reasons, but it is a personal decision. Lastly, in the form, it's kind of an odd place to put this, but there's whether or not you're a donor or not. And you can confirm a choice you may have already made with DMV, or you can just leave it blank if you don't want to be a donor. It just kind of bothers me that this choice is in a healthcare directive. Just seems like the doctors are overly motivated to harvest us. But anyway, it's a box that needs to be dealt with. There's additional spaces in the statutory form if you want to be more specific or more limiting in care. I still think it's better that you let your agent know what those specifics might be. They're the ones that get to make the decisions. And like I say, the doctors generally don't read all the healthcare directives that are scanned into charts, and they're probably not going to remember if they even had a conversation with you. So just make sure your agent knows what you would want or not want. So to conclude, if you're lucky enough to have a parent, a spouse, an adult child, or a best friend willing and able to act for you in the event you become unable to speak for yourself, complete the healthcare directive form now. We never know what life event will come our way where the healthcare directive would come into play. The form is simple and easy to complete. It may save you and your family from having a crisis over your care, from having to pay thousands in legal costs, or to manage a conservatorship, and from having to pay for health care you would not have wanted. So anyway, that's my short presentation. It's a very short and simple subject. Thank you for the opportunity to speak with all of you today.
Thank you so much, Ken, for going over advanced healthcare directives with us. NAMI California has been surveying across the state annually, and this is one of the questions that has always come up is, can we learn more about advanced healthcare directives? Also in some of our focus groups, it's been brought up, which brings us here today to have this conversation. So we're so honored to have you here with us to discuss. What I'd like to do is open the floor to questions and Huba. If you guys have any questions for Ken, we have several minutes that we could kind of go over those questions, and he'd be happy to answer those for you. Please just message into the Huba chat. You can just click ask a question under the Q&A session on the right-hand side, and I'll get those over to Ken for us. I'm just kind of taking a look over here to see if there's any questions coming in. So, as of right now, I don't have any questions coming in quite yet. I will just give everybody kind of a minute to type those out, and then we'll get them to Ken.
I can't imagine I was so clear that people would not have questions, but
Okay, when you do an amazing job, you just do an amazing job, Ken.
no, it's kind of a no-brainer topic. The biggest barrier to getting these things done is people literally not wanting to think about it. Many people that are pushed into my office are pushed in there by family members because nobody wants to do that. I'm guilty myself. I think I was in my 50s before I'd actually signed the documents. I'd prepared many versions, but actually getting to a notary to sign a document just seemed to be something I could do tomorrow. So procrastination comes with the territory here. Just don't procrastinate too long. If you're looking at this presentation, it's not too late.
So we do have a question from Karen, and that question is, what is the difference between regular power of attorney versus a medical power of attorney? And can regular cover medical? And what do you recommend employers mention medical power of attorney to? Would you recommend that an employer mentions a medical power of attorney to employees?
Okay, the powers of attorney, there are actually many kinds. They can be general, they can be durable, they can be, limited as to time, they can be limited as to subject matter. The medical power of attorney is specific to healthcare. I've not seen a durable power of attorney include healthcare decision-making. So we usually have two. We have a financial power of attorney that can handle, running your corporation, evicting your tenants, dealing with tax issues, basically everything a person could do with a bank or a financial institution. That's under the financial one. And it's really none of those people's business what your healthcare decisions are. So we keep them separate. The medical power of attorney, we build it into the combination advanced healthcare directive and combine it with the living will. And that's really between you, your agent, and your doctor. So we don't really mix those two. I don't know about an employer recommending someone have one. It's really, a medical power of attorney is really none of their business either. everyone should have it, but it's certainly not something that they should keep on file or even know about. You still have medical rights to privacy, and you should keep those.